If you suffer from peripheral neuropathy, you know how it can disrupt your life. You probably also found out that not many healthcare professionals know how to deal with it. Our next guest says it makes no sense to simply treat the symptoms. Instead, Dr. S.Tao from Texas Regional Health and Wellness says you need help getting rid of the problem.
Good morning.
Explain to us the kind of the philosophy behind Texas Regional Health and Wellness.
Well, our philosophy is we don't just cover up the symptoms. We actually look for causes of why a person is suffering what they're suffering.
Yeah, a lot of people have started to hear more and more about neuropathy, and that's because many more people, I think, are suffering from it. Explain to us what it is, what's happening inside the body, and what some of those symptoms might be.
Well, peripheral neuropathy, by layman's term definition, is that the nerves are degenerating. And that means they're deteriorating, they're dying for whatever reason it is. So when it's dying or degenerating and it's producing symptoms, that's what most common people feel or complaining about. And that's usually why they're in a doctor's office, because they feel the way they feel.
Yeah, and those symptoms have gotten their attention. It may be a couple of symptoms or several of these put together, but run through some of those. So if people hear this, they might know that they might need to be checked.
Well, the nerves control a lot of functions in the body. So as a nerve deteriorating, it gives out signs that it's dying. So things like pain, numbness, tingling, poor circulations, and metabolic disorders and lost balance, a rate of different symptoms as the nerve can't control the body anymore.
Yeah, what causes it?
Well, there's all kinds of causes. That's where it makes it difficult to treat. It could be various things such as diabetes, previous trauma, poor circulations, and some sort of autoimmune diseases, and could be also caused by exposure to toxins such as chemotherapy, radiation therapy. Those could cause damages to the nerves.
Yeah, we hear all the time patients say, well, I left the office and the doctor gave me pain medication, or the doctor said I should get a massage, or and those things aren't working for them. What makes you different?
Well, that's because whatever the symptoms relieves aren't aiming like why the nerves are deteriorating. So unless you can stop the nerve from deteriorating, the symptoms will always persist. Now, when you let it go long enough time, the problem gets worse and worse and more symptoms. So most doctors actually chase after symptoms. So that's what makes it really difficult to treat and provides very little to no relief at all when you just chase after symptoms.
Yeah, just like you mentioned, there's all kinds of reasons that can cause neuropathy. People come in at all different levels. So you look at them as individuals. You start with a nerve scan. What are you looking for in that scan?
Well, in nerve scan, that gives us an idea whether the symptoms you're complaining is caused by deteriorating nerves. And the nerve scan, actually now technology allows us to see how much damage it is. And that gives us an idea that we should be start approaching to why the nerves are deteriorating. And that will be the first step, and the most effective step.
Yeah, and it's so important to get evaluated, to know what's going on, and also to know how advanced it is, because you say past a certain point, I mean, the body will put up with a lot, but past a certain point, it just gets much tougher to treat.
That is correct. We all have limitations. No matter how great a doctor or how great of a person is, they can't do everything there is to do for an individual once they pass a certain point of no return. So we always advise patients, please don't wait until it's too late.
Yeah. You know, we mentioned earlier how a lot of doctors, this is just not their wheelhouse. It's not what they treat. And again, I'm going to reiterate, tell us about the book that you've written.
Well, there's a book coming out. It's going to be coming out in 2022. It's going to be talking about why we're losing our battle against chronic diseases. The statistics shows that we are not making a dent on chronic diseases, and we're losing the battle. The reason we're losing the battle is really because we're not approaching from the right direction. So the book is going to offer the insights to as why we suffer from the chronic diseases. Once we understand the why, then how to overcome the degenerative diseases and the chronic diseases will be much more making sense.
Yeah, more preventive than trying to maintain the situation that you're in, which again goes back to the philosophy that you talked about. Dr. Tao, thank you.
My pleasure.
Dr. Tao and Texas Regional Health and Wellness have a special offer for Great Day viewers. The first 25 callers will receive a complimentary nerve scan. That's to help you determine if you have nerve damage. This is a $149 value for free. Give them a call at this number, 713-560-7007. That's 713-560-7007. For more information, you can visit them at their office in Missouri City or go online at mytexasregional.com.